Hi everyone and welcome back. Again we're here on the second video talking to Deirdre and Sharon about grief. On the last video, Deirdre and Sharon shared their experience in the work that they do around what grief is, what it can feel like and the impact that it can have on people in any situation, and at this time of COVID how it is got a much heavier weight and complexity about it, isn't that right, Deirdre? And something that you have been discussing also, Sharon, and talking to us outside of making videos too, is about how real the impact of grief can be and how different it can be for every person, for all of us. We may well experience that very differently, and even within the same families and communities, because we are individuals, we will likely experience that differently too.
Absolutely, and I think sometimes grief has always been with us, and grief is always difficult prior to COVID, and it has got added dimensions now. But I think one of the important things, if we're going to take care of ourselves, is to recognise that at an individual level our grief is legitimate. Every person's grief, the pain that they carry, the emotions that they are responding to, is totally legitimate. There isn't a hierarchy of grief. You may look into somebody else's circumstances and think, what right have I got to grieve under my circumstances of loss? But I think it's really fundamental that we give ourselves permission to say, I'm grieving, I have lost, and therefore my grief is legitimate, and that gives us a context to say, it's legitimate for me to take care of myself too.
Yeah. And in the midst of all that, some of the things that you had said, Deirdre, were very much around in the last video, what we feel, the emotions and the sensations that we can go through and how challenging that can be. And I think it is really important to be able to acknowledge that, to say that on video, to say that out loud, that it is a very difficult time, it can be very challenging, and sometimes we can run away from it and try to avoid it in order to get away from the pain, which in fact is very natural and is a normal response. And is there something then, Deirdre, in terms of those symptoms and sensations that we can often flow through? Is there some way in which self-care, we can use self-care strategies and techniques and what they might be at these times?
Absolutely, and it's vital that we do that for ourselves in this time, because this is a time where self-compassion and gentleness with ourselves really needs to take priority. If I'm tired, I rest. If I am tearful, I cry, let the tears come. If I am cross or irritated by, whatever it is in relation, however my grief is manifest, feel the feeling, that is all right. That is how it is for you. And yes, your sister or your brother, that may not be the case for them, but that's because their relationship with your daddy or with your brother was different. So because their relationship was different, their experience of grief is different. So for me, I think it's really important to allow ourselves, as I said, to rest, to try and eat well. And I know that can be a real challenge, because there is something so comforting in a big fat burger, and yes, the odd one is good, but we really want to try and be gentle with our bodies as well, because there is a physical reaction in grief along with fatigue for people. So try to eat well. If you don't have an appetite, try and indulge small and often. Sleep when you need to. Maybe a wee bit of exercise is good, because there is something restorative in nature for all of us. And things that have worked for me before, they will work for you now. But above all else, be gentle with yourself in this time.
So there's something very strong there. So are we want to say?
Well, I was just thinking, you triggered something in me there, Deirdre, and I was thinking too that for most of us, being in the spotlight, even in an individual spotlight around our own grief, is an uncomfortable place to be. We want to be out and helping other people, and to be in a position where we need to take care of ourselves and it's a place where we are very much on our own, and it's a lonely place to be. But I think there's also something about being open to accepting help from others. And while we often want to be the person who's doing, that if we can actually allow others to help us and be part of our restoration, it's a really important thing to do.
Yes, absolutely. And I think that's very much about nurturing the self, isn't it? And you know, attending to the grief, attending to the loss, attending to the fear, even acknowledging all that range of emotion that can come through grief. When you attend to it and you acknowledge, recognise that it's here, and that's a part of who you are and part of your reaction. And there's something about attending to that, and then in some ways being able to develop some ways of befriending that instead of avoiding or running away, nurturing the self physically, nurturing the self emotionally and psychologically, and just being present in many ways, which can be very challenging. Yeah.
I suppose just to add into that piece, you know, when I say, if you feel the tears, cry the tears, there are very few of us who are comfortable with sitting crying. And so there is resistance in it, but in that release, to allow that release and be easy with it is good. Even if it is a sob, you know, there is something embodied in that release for us that is, as I say, is really important.
So some of the things you've talked about in terms of what you had said, Deirdre, about you've got through things in the past, so you know that's part of who you are, and you know you can get through difficult situations again. Ways of managing the challenging feelings and emotions that come up in a staged sort of way, and trying not to be afraid of that as you go through, are all very useful things in not necessarily overcoming, but getting through, coping and managing.
And recognising sometimes we're coping in the moment.
Yes.
We're enjoying the moment, you know, we're out planting bulbs again, or we're out tending to the garden, and that gave us joy before, and that it's important that we do those things, and those are restorative. And by doing those things, it doesn't mean to say that we don't love or we are disregarding our loss in our life.
Yes.
So I think it's important to say it's absolutely fine, it's good to be out and doing things, and doing the things that give us joy.
Yes, absolutely. Often people can talk about feeling guilt for doing those kind of things, so it's about recognising that it is okay, and that's a really strong message. Thanks very much for that, Sharon. In our previous videos we have talked about having developing ways of managing the anxiety and the fight, flight and freeze responses that we can have, that will often come up during loss because of that rocky ground that you talk about sometimes. Judy, we don't know where we're at. Our stability and our certainty has shifted, so what does it feel? What does it feel like? What can we do about it? And there's a lot of strong messages in the previous videos around getting through the day, having some kind of routine and structure, managing any anxiety that comes up, and having hope and how we can nurture that hope. I think that is absolutely key to this piece in particular, having hope. And is there other ways in which you think hope can be nurtured for people as they go through the days where there are a lot of challenges and a lot of pain?
I think there are. I mean, in the immediate and in the moment, the self-soothing, I think, is the message that we really want to strongly communicate about, that giving yourself time and being gentle. But something that you were talking about earlier, Sharon, this morning, when you were talking about, you know, as time moves on and that continuing bond stuff, I think that might be useful, maybe about even a reassurance in hope.
Yes.
That there is a time. Do you want to?
Yes, and I suppose just picking up on two things. In the very early days, we are saying things that are not going to land in you very well, because we're conscious that there is so much pain. But if you can acknowledge that what you're doing is grieving, and that have a little bit of confidence that to try these things out and to see whether they work for you. And certainly what we find when we're grieving, that we're yearning for the physical connection with that person. In the early days, that separation is so difficult, But over time, quite often we find that our relationship continues in a different way, and that what we do is we continue to relate, and that those relationships remain strong with us and continue to enrich our lives. And that's a really healthy place to be. So if you find you're having conversations with the person who's died, that's absolutely fine. Don't worry about that. That is an indication that you're doing really well.
That's great, really strong messages, and thanks very much for that, Deirdre and Sharon. The next time we'll come back to discuss the subject a little further, because I think we can go a little further in how we support other people as well and be a supportive community. So thanks very much for that. Thank you, folks.